guys, it's Dr. Shelly with HETV, and I promised you we were going to do a video on 10 quick tips about this NCLEX exam that you can take with you. They're very practical. You don't spend anything much at all. It's a little bit of investment on your part, but it's 10 quick tips to help you pass the NCLEX exam. Now, nothing worth having is easy. So this is, it's a bit of a challenge, but think about it this way. Physicians go to school and train on average 12 years before they get out here and are official, right? They're officially physicians when they're residents, but they're still training. And it takes 12 years. You are here as the nurse, the person in the middle between the doctor's orders and the actual care of the patient. And if you're not in the middle to catch some of their mistakes before they end up with the patient has bad outcomes and could even die. But you only went to school 1, 2, 3, or 4 years. So what I beg you to do is to take this NCLEX seriously. Look at these 10 steps. Be conscientious about the fact that you've got to put up to get out. And I think you'll feel good about your outcome. So here we go. Let's get started. Tip number 1. Plan to test within 90 days from graduation. This is a very big, probably most important tip out of the 10 tips on how to pass NCLEX. And the reason why is because I felt like every other person I talked to who failed their NCLEX exam did so when they went on vacation after graduation from nursing school. Instead of pretending like they're still in nursing school, staying in the academics, going hard, making sure their work schedule was not too overwhelming as they studied for school, and pretending like they're still in school until they can pass this test. The 90 days or 12 weeks is really important because I put on HETV in YouTube, I put the 12-week schedule on there for you to follow. It's very, very systematic. It's in order. You can do this. It's usually like 2 subjects a week. And I think you'll feel good about it. But when people go on vacation immediately after nursing school, they tend to come back and have a hard time getting back into the academia that they need to be in to pass the test. We just had 3 people testify yesterday about passing their test, and one of them went to Palestine right after vacation, and he felt strongly that was his big mistake. And I hear that all the time. So come on, stay in the game, graduate, but know that after you get that cake with that stethoscope on it, you got to get back into the game, baby. You got to come on back off that bench and let's go with a touchdown. Can you tell I like football? Tip number 2 of the 10 tips on how to pass your NCLEX exam is buy UWorld RN. Now let me tell you something, because I don't get no kickbacks. I don't get no reward. I'm not advertising for them. I don't know them people over there at UWorld. But what I can tell you is that I have a PhD. What I can tell you is that I've done all these software, the RN Mastery, the boot camp, the Archers, all that. I've done it, and I can tell you as a very educated, well-experienced nurse of 40 years, Archer's too easy and everything else is a hot mess. It's UWorld RN. Even if you are an LPN, you need the UWorld RN because you're going to be shocked at the fact that you do get EKGs on your exam and you don't get the benefit of those on UWorld LPN. The UWorld RN is so important for your success. I know it costs a little bit more and you need about 90 days. To be honest with you, you need that whole $249 package for 90 days. And in the UWorld software are pre-assessment. They don't call them pre-assessment. They call them RN assessments. I use them for my pre-assessment for you guys. And then we use them for whether or not you should even take a test at all the week of the test or reschedule it. We have that, plus we have over 500 videos in UWorld to look at on real specific subjects that are on this NCLEX exam. They complement my videos in HETV. Their subjects align with all of my playlists in HETV and handouts. And so I have felt strongly that UWorld is extremely beneficial to students. So please invest in yourself and buy the UWorld. Again, they ain't giving me no money. I wouldn't take it if they offered, because that's unethical, and I ain't that girl. I don't need it. Tip number 3. Probably one of the second most important things you can do when you're looking at the 10 tips to pass your NCLEX exam is study one subject at a time. You need to beat the shit out of each subject, starting with psych. It's important that you start with psych and then right before your test, go back to psych and review. Most of the medications on the NCLEX exam are going to come from psych and cardio. So you need to put some investment in starting out, looking at the psych as one subject to start with, and then going from there. I have the entire schedule of how to do each subject one at a time. I have all of that in the Oh My God packet, so you don't have to worry that I don't know what order to do it in. Most of you know I have a bunch of pink packets, and that these pink packets are truly the way to go. So here's the Oh My God packet, and everything I'm saying is in there, and it is how you go one subject at a time. I'll show you for an example how we structure it. And I want to let you see the 10 subjects we give you to start with. That's not the extent of them, but that is the 10 that we start with. And you need to get these subjects handled and mastered so that you can literally deal or handle any question the NCLEX would ask you in that topic. So one subject at a time. Tip number 4 out of the 10 tips to help, the top 10 tips to help you pass your NCLEX, is you can't just do questions. You must study the content as well. I can't tell you how many students come in my class, or I talk to them on the phone doing consultations, and it turns out that all they did was Archer, or all they did was UWorld, or all they did was fill in the blank. No. Questions are not the end all and be all. This is an actual patient. You must understand the pathophysiology, the signs and symptoms, the causes, the risk factors, the complications of all diseases as you approach this test. And you can't do that unless you actually are studying content. Now, again, the Oh My God packet gives you the subjects. You just have to go to the HETV playlist and pull those babies up and watch the video. Do 5 questions. Watch another video. Do 5 more. Watch another video. Do 5 more. Video questions, video questions, video questions. And don't forget to review the rationales of the actual questions that you did. That's why we keep our quizzes kind of small. Next is reschedule your test. If your average a week before you test is not 80 to 85% for the RN, 70, 75% for the LPN. Let's just put it this way. I have done thousands of consultations with students. 99% of those have nowhere near an 80 to 85% average when they took their test if they were an RN. And they absolutely didn't have a 70 to 75% average when they took their test as an LPN. You know what I hear all day long? Well, I got 60s or high 60s. I got some 70s, RNs, right? For the LPNs, well, I got some 50s and a few 40s, but some 60s. No, let's think about this logically. If you are a teacher and you give your students an exam, 100% is an A+, 90% is a B+, 80% is a C+, and 70 is failing and a D. And in nursing school, you couldn't get a D, so you know that's failing. So why did you think that 60s and 70s was good enough to pass the NCLEX? I hear this all day long. I want to throw up in my mouth. I'm like, what the fuck? Did anybody stop to think? No. I know that these assessment tests kind of lead you to believe you're ready by saying, oh yeah, you got a good chance of passing. You got a big whopping 68% or 72%. Wrong answer. Just think. 60s and 70s is failing. The reason why we let you get 70 to 75 as an LPN is because I have given you the software of an RN, UWorld RN. So of course your scores can be a little bit lower and you're still going to pass. Now listen, I've been doing this for 20 plus years. I've been a nurse for 40. I have a PhD and I studied how to pass an NCLEX for you guys' sake. And I can tell you my classes high passage rate up here in Cleveland, Ohio, whether it's a 3-day boot camp or the regular course, this high passage rate is because I am strict about those scores. If you don't have those scores, sweetheart, just reschedule. You don't have to pay anything to reschedule, just reschedule. Now you will have to reschedule within 24 hours. So let's say that your test is at 8 o'clock tomorrow morning and it's 8:01 today. Too late, you're going to be taking a test tomorrow. Let me say something else to you as well. If you're in a situation where you did a little bit of studying, you did get something I was saying today, and you did start some of the things in my HETV playlist, and you did start doing some of the things I told you to do, and you have an expiration coming, and you're like, but I haven't done Shelly's program long enough. Listen to me. Please never let a test expire. Still take the test. You'd be surprised at how much you may have picked up from our playlist along the way. So I tell people, don't waste a test. What's the worst that could happen? The same thing that would have happened had you never met me. Maybe you fail, right? Okay, well, at least you got your tools. Get back on the horse. Let's go. All right, let's go on the other side of the board for the top 10 tips on how to pass your NCLEX. Tip number 6 can be confusing, so please listen up closely. Never do more than 25 questions in a practice test, but do many tests a day. So let me give you that example. Today, you don't have to work. You woke up, you already purchased UWorld RN. You woke up, you did 5 UWorld questions after you watched a video in psych. Then a little bit later in the morning, you watched more videos in psych and you did 10 questions. For lunch, you were sitting there doing your lunch thing, watching videos. Right after that, you had a little bit of energy. You did 25 questions. A little later on in the day, after you picked the kids up from school, you did 5. While they were waiting on dinner to get done in the oven, you did 5 more. Right before bed, you did 5 more. So what I'm saying is that the test itself, the one test that you're currently doing, can never have more than 25 questions in it, but you're doing a lot of these tests in a day, not just one test. No, you are striving to do 300 to 500 questions in a week. Okay, so you're doing a lot of tests a day, and those questions are in one subject at a time. Just like the way you're watching your videos is one subject at a time. Psych videos, psych questions. Now, once you get, watch this, that 80 to 85% that I told you the RN needs, or the 70 to 75% that the LPN needs, now and only once are you doing a final exam in that subject. Let's say it was psych, 85 questions to see if you really know it. If you don't, you got to go back to your little 5 to 25 every day, all day. And then when you're ready, you got to move on to the next subject. All right. Number 7 is the biggest mistake I see for repeat test takers. Never, ever, ever, never, ever, ever, never, ever, ever retake your test in 45 days. 100% failure. Yeah, 100%. unless you were like deathly ill and throwing up and diarrhea the day you took it and that was why you failed. Never retake this test in 45 days. You know nothing. I know you get that letter from the board that says you can retake your test in 45 days. So fucking what? You do not take that test in 45 days. You do not take that test until you have objective data to says you're ready to test. Now, when you buy that UWorld and you see that RN assessment, RN assessment, RN assessment, they give you like 2 or 3, the way you're going to know you're ready to test is you're going to do that RN assessment. It's going to be 100 questions. And if you get what? 80 to 85% for the RN, 75% for the LPN, then your ass is ready to test, but not in 45 days. I've not seen much success with that at all. And I thought I'd bring it up because I hear about it all the time. My God. Okay. Make flashcards, okay? Just do yourself a favor. Make your flashcards out of your infectious diseases and your medication categories. So you don't have to use my packets, but I find that these are pretty easy. So in the Oh My God packet, there's some quick pharmacology tips, but the meds that you're making the flashcards out of is your medication categories. This is updated this year and it has everything. So it has, for example, your antihypertensives, right? It's got in here your diuretics. And in your antihypertensives, we're talking beta blockers, ACE inhibitors, calcium channel blockers, ARBs. We're talking categories. It's the category that goes on the flashcard, and on the back of the flashcard, what they're used for. So you can see your thrombolytics, you can see the anticoagulants, and in this packet you have everything. You have your asthma meds, your psych meds, your antidepressant SSRIs, your benzodiazepines. I'm looking at NSAIDs, steroids. I'm looking here at your autoimmune drugs, your patient's antiplatelet categories, antiplatelet aggregates like aspirin or Plavix, which is clopidogrel. You have all your GI medications in here. You even have your TB meds, your teratogens, your ototoxic medication, which means it's toxic to the ears. You have even your herbs and your vitamins, which you have to know. So you're making flashcards out of those. And when it comes to the patient's infectious diseases, you know that we have the infectious disease packet, and you know we give you a list of all the infectious diseases where you make the flashcard. Now quit looking for me to make your flashcard. You making this damn flashcard. That's how you gonna learn. And when you make this flashcard, you are putting the infectious disease on the front and then the information about that on the back, okay? My videos will tell you everything you need to know on what to put on the back of that infectious disease flashcard, but you gotta know your precautions. You gotta know if it's airborne, contact, droplet, or standard, okay? Number 9 out of the quick 10 tips on how to pass your NCLEX, number 9 is that if you failed before, review your CPR report, and then no matter who you are, please know your basic care and comfort and your reduction of risk. Here's what that means. We know that this test has 2 areas of common failure, like 2 areas. The first area is basic care and comfort. The second area is reduction of risk. This is your procedures and reduction of risk. This is your Oh My God packet. Your basic care and comfort comes out of these 2 packets because basic care and comfort is diets and positioning. Basic care and comfort is all of your respiratory, pulmonary hygiene and toileting, like cough and deep breathe, or pursed lip breathing, or incentive spirometer. It's canes, walkers, and crutches. It's, you know, your catheter and your elimination. It's all of this. They're all in here. This is basic care and comfort. comfort. And so when you know your basic care and comfort and your reduction of risk, those are two big categories that are the #1 failure areas on the test. Now, don't worry. On HETV, we have a playlist for those categories. And when you review your CPR report, maybe it was management of care, maybe it was pharmacology, maybe it was psych, I don't know, but I can tell you this, wherever you were below in, and if you miss more than 2 belows, if you got more than 2 belows, you really need a class. Maybe you need a 3-day boot camp class in Cleveland. It's very affordable, plus really, really affordable hotel costs. Just text me at 216-410-0936 for that 3-day boot camp information. We get people, we had somebody come in from Saudi Arabia, 19-hour flight. We have people from Florida and Michigan and Pennsylvania and Arizona and California all the time. For 3 days, it's a great investment. You won't be sorry. Or maybe you need an actual regular course where every single week for 5 months, you are in my class learning and listening. I don't do Zoom and I don't do the online. I do it right here in Cleveland. So I get that it might be a bit of a struggle, but if you can't do either of those, just watch the NCLEX NGN self-study tips and guidance in the playlist. I think you'll find success even though you can't come up here and hang out with us, okay? Now, the last thing, and this is just you and me, baby. Your girl has lived a while. Your girl knows. When we're finishing up these 10 tips to get you to pass the NCLEX, you're gonna have to cut back on work. And maybe you're like me, where you got no help from mom, dad, nobody was helping you. It was you and your baby, and you could not cut back. Well, then I need you to be realistic that you're not gonna be taking this test in 5 days or 5 weeks or even maybe 90 days. You might need a little longer because you got to work and you can't cut back. I couldn't cut back. I was 50, 60 hours a week. I feel that. Okay, I get that. But here's the other thing. You are absolutely going to have to be selfish. What does be selfish mean? Well, your kids can eat peanut butter and jelly and be fine. Stop trying to be Chef Merlene and cooking up big ass dinners and shit like that. You can't be the taxi mom. Why did you sign up Bebe and Shay Shay up for all these extracurricular activities and then your ass got to drive them everywhere, get back home late from the football game and all this nonsense? You're going to have to sacrifice. They're going to have to sacrifice. They're going to appreciate your sacrifice because it's your sacrifice that will ensure their stability and longevity and their wealth going forward. So you might have to be the bad mom and say, I can't do it this semester. I've got to focus on passing this test. I promise you guys, once I pass my test, you're back in the game, okay? Now, another thing, I am very much a church attender, right? I go every Sunday, blah, blah, blah. I love God, blah, blah, blah. But see, God is not just in a church. God is in your spirit and your heart. So you might have to miss church. You might can't sell the chicken for the church fund, building fund, okay, that goes on all year, every year for decades. You maybe can't attend that extra service on Wednesdays for Bible study. Your ass might have to take a leave from the choir. You have to be selfish. Church will be there, but will this test? So be selfish. You might have to explain to your man well in advance. It's going to be a little rough, baby, but when I get done passing my test, you and me, you know what that means. But until then, your man, your husband, your flavor of the month, whatever else you got going on, need to sit down somewhere. Your parents, sometimes, I don't know about you, but your parents can be very demanding. And I talk to a lot of Indian students who tell me they've got to take care of their in-laws and all the stuff that goes on with the house. If your husband loves you, you will have a conversation about how this is going to be a struggle for me to do all this hot mess. And you're going to have to call your brothers and your sisters and everybody else that you can to try to pull in some help to help you with these parents. And now listen, the last part of this, if your children are calling the peeps on you because you made them eat peanut butter and jelly every day, you're on the right track. If your parents threaten to take you out the wheel because you neglecting them, you're on the right track. If your man files for a divorce You're on the right track. He was sleeping with the enemy any damn way. Who divorces anybody at a test time? So I'm just trying to tell you that you've got to put this test first. Now, last but never least, baby, pray. Just pray. Shit, he got it. You trying to get it. Talk to the man who got it. Now, I don't care if it's Allah, Buddha, Jesus, God. I'm not that girl. I'm not ready to blow up 2 twin towers about some crap like that. I'm telling you, whoever your higher power is, bow down and pray, because that is how I did it. And I can tell you, he creates miracles out of nothing, honey. Look at me. I dropped out of high school pregnant. Welfare, got my ass beat by the baby daddy. And look, y'all, we doing big things up in Ohio. You got this, baby. I hope this helped. Mwah! Deuces.